Well, good evening, everyone, and good afternoon as well. And I just want to thank again all of you in the organizing committee for having me here today. It's a pleasure to have this opportunity to represent this latest report from the Broadband Commission on behalf of the larger working group and all of the Broadband Commission working members. And so to start here, I just want to give some background again for those of you who may not be familiar, but 10 years ago, the ITU and UNESCO developed and launched this Broadband Commission group to essentially ensure greater access to broadband globally, and in that effort support national governments and international organizations in development targets such as the Sustainable Development Goals. And since 2016, they launched a working group on digital health, which we have been co-chairing since. And I just want to take an opportunity to thank this network for their contributions throughout the last 2 reports and this 3rd final report here that we've come out this year. So I just want to again thank everyone for that. And for this presentation, I'll just give a little bit of the background on some of the previous work of this commission, and then dive into the latest report here that's called Reimagining Global Health Through AI, the Roadmap to AI Maturity. So again, as part of this background, it's crazy to think that 2017 was when we launched that first report, because now it feels much further away than it was. But this was the first kind of, let's say, call to action to governments to really develop national digital health strategies and recommendations to really build senior government leadership and commit financing, effective governance mechanisms to ensure that there was a collaboration across ministries, but also to ensure collaboration between the public and private sector, and also to develop national ICT frameworks to facilitate alignment between the healthcare sector needs and those of the technology players wanting to integrate their solutions into it. So in many ways, this was a bit of a blueprint of the work of this Broadband Commission working group to really be a high-level advocacy mechanism to work with governments and help them think through their priorities, but really, again, emphasizing how important it is for governments to take the leadership in this space to make sure that they can leverage to the maximum the digital health solutions and now AI solutions that are emerging in healthcare systems. So following that report in 2018, there was an opportunity identified by the working group to really see how can digital health enable and digital health solutions really help address the growing issue of non-communicable diseases in low and middle countries, since we know that NCDs represents an enormous burden on healthcare systems. And so through this framework already as well, 6 building blocks were introduced, and I'll just briefly go through them. Is again a reminder that policymakers need to prioritize and lead on national digital health strategies if we want to make sure there's cohesiveness across the healthcare system, and that the 2 solutions can reach scale. And with that as well, the legal frameworks are critical in ensuring that patients have their rights protected, but also that there aren't barriers that are enabling the innovation that needs to take place. The 3rd pillar is around standardized infrastructure. So making sure that information can be used and shared effectively across different levels of care, which again is so critical for NCD patients who have chronic care, so lifetime diseases, and often find themselves moving up and down different levels of care pending the progression of their disease. And interoperability, of course, is a key issue again, and continues to be, whereby how can we ensure that diverse digital health solutions and data sources can be synchronized and coordinated to ensure adequate NCD management. And the 5th pillar is around partnerships. So again, how can we ensure that expertise, assets, and ideas can really help ensure that all the players are at the right table to scale up solutions? And this is paired up, of course, with the last one around sustained financing, which we see as mandatory if we really want to think about solutions that can have a long-term stickiness, let's say, and make sure they're fully integrated into the system and can be sustainable. So with that background in mind, the 2020 working group on AI and global health started work in 2019. This was a group that was co-chaired by the Novartis Foundation and Microsoft, and had more than 40 technical experts contribute to this work. And what we did is, again here, what I'll go through is just share a little bit why we saw the need for AI and the need to address this topic in the report. Then going through some of the landscape of case studies that we've bucketed into certain use cases, and then going to introduce this framework that I've hinted to. So we wanted a reminder, and I kind of pose the question again to people as to why AI in health matters. And I think the bigger background, especially within the current pandemic that we're experiencing, is that there are trends here that are clear, and many of you are familiar with these, is that are putting enormous pressure on healthcare systems, and these healthcare systems are just will no longer be capable to address the growing burden of disease and the demands on them. And so it's why there's a need to rethink how health systems work, how they provide care to their populations, and why we think AI can have such a key role in doing this shift from healthcare systems that think about treating patients on the cure to then looking at becoming, and so being reactive in essence, to becoming much more proactive in the way they seek to keep people healthy, and can be even predictive in the way to ensure that they can look at risk populations and see that they can early on address them and make sure they lead healthier lifestyles. But again, these trends here that you see on the screen are around this global healthcare spending that's projected to reach 20 trillion in the next 20 years. We know that healthcare worker shortage, where 50% of countries still have less than one doctor per 1,000 people. And this paired with as well this rapid urbanization that we're witnessing, where 70% of people will live in cities by 2050. And so increasing exposure to unhealthy lifestyles. And when it comes to urban settings, we see both a challenge in terms of how it's impacting the health of people, but we also see cities as key public health actors that if they can be reorganized and leveraged to actually help improve the lives of people, rather than being sometimes really this centers where people tend to have more lifestyles that lead to NCDs, for example. We also know that one of the key trends here and one of the key data points is that we still have 734 million people who lack access to essential health services. So again, all a pressure point for us as we want to address universal healthcare coverage. We're still far from the mark on this point. And to look at the below the last three trends here, dual disease burden. So we've already talked about the burden of NCDs, but this is paired again with infectious diseases that remain prevalent. And with COVID being an example here of emerging threats that are coming in, we're starting to see this kind of syndemic type of pandemics that we're looking at this enormous pressure at the same time on healthcare systems. And unfortunately, this year is really proving the point where they can't cope with both the patients who are being impacted by the pandemic, but also those patients that need continuous care and can't seek it as a result of the situation we're in. And last but not least, is just again, this question in this continuous evolution of misinformation and disinformation that we see in all sectors, and we see it also in politics, but in the healthcare system, especially in the current context of how are people thinking about public awareness and public education campaigns, as well as the question around vaccine use. There's a lot of incorrect health information out there that's unfortunately putting a lot of millions of lives at risk. So once again, this slide is just to remind us all as to why we think there's a drastic change that needs to take place, and that AI can play a key role in helping health systems cope with these large pressures that we've highlighted. So moving forward with that, one of the key pieces of work of this year's working group was looking at over 300 different examples of AI case studies. And what we were trying to do here is look at this question of course, there is a lot of hype still around what AI can do, but at the same time, demystify that hype and actually look at what is working in different settings. And it became clear that there's a lot of very tangible examples of AI uses in different settings and for different purposes that we've highlighted and basically bucketed into 5 type of use cases, which I'll run through here for you. And again, this is the example, is to really make it tangible to see how it can really have a benefit for health systems and for patients. So the first one is, the first use case that we defined is population health. And this one here is really about how can we think about targeting public health interventions through predictive analytics. And an example that we've highlighted in the report is Magic Box from UNICEF. And this is really a compelling example where they've been able to reshape their response systems for epidemics and public health emergencies, where it has used its AI solutions to generate forecasts about the spread of Zika, dengue, yellow fever, and Ebola in multiple settings. And for example, as you can see in the bottom left here, it was able to recall 100% of the yellow fever cases reported in the Americas between 2000 and 2018 with 95% precision. And it's starting to really see how it can leverage multiple data sets. So I think, again, here, as we're thinking about the data that's feeding into these AI algorithms, they are leveraging data coming from meteorology, air travel, phone records and social media, and as well as public health data that's available. And with that, it's able to map out and predict the progression of diseases and epidemics, and through that, therefore, better create more targeted public health interventions to reduce the spread of the disease. So these are really compelling solutions that I think will be scaled in multiple, and we'll be seeing more of. And again, it's a reminder that these can help fight diseases that are still causing millions of deaths and billions in economic damage every year. Now, moving on to the second use case out of the 5 is how AI is being leveraged in preclinical research and clinical trials. So how can it be leveraged to optimize drug discovery and design, personalized therapies, and trial design and execution? And so, as you can imagine, whether it be large pharmaceuticals or smaller biotechs, this is an enormous kind of space right now that people are trying to see how can existing or new data sets be leveraged, and how can an AI look at providing insights on this data that may have not been found before. So an example would be the company Benevolent AI that works with multiple partners in the healthcare sector, where they are looking at data that was used in clinical trials for certain targeted diseases that may have not worked. And with the data, are able to now kind of look at whether some of the solutions that some existing therapies could be used for other target drugs, and at the same time understand which are actually the populations that would benefit the most from these medicines. And so with that, they're seeing a lot of innovation and also an incredible change in the scale, in terms of time scale of research and development, whereby Benevolent AI was able to work with one of the large pharmaceuticals early in the year, and within a couple months was able to identify an existing drug and repurpose it to be used for the treatment in COVID. And therefore, from a space of a couple months in Q1, went into clinical trials to essentially be seen if it can be effective in this fight. So there are many more examples, but this is definitely an exciting space to be looking at. The third use case out of 5 here is the clinical care pathways. So how is AI being integrated into new and existing clinical workflows? So again, we have several examples in the report that you can look at, but I would single out here, for example, Apollo Hospitals, who partnered with Microsoft in India to develop a specific heart risk score to better predict cardiac diseases among its population. And what's been really incredible here is that they've been able to double the overall risk accuracy of cardiac diseases in India by essentially leveraging all of this, all the data across the hospitals of the Apollo network in India. And now more than 200,000 people have been screened using this AI solution. And it seems that they've been able to predict the risk score of patients 5 to 7 years in advance. So what this is starting to mean is that through this risk score that they've been able to create, they're able to do earlier diagnosis and prevention and ensure people at risk can be put on treatment or making sure we're addressing the risk factors that could lead them to have further complications, whether it be heart attacks or strokes. So for us, this is a very compelling example, and glad to talk more as we're doing similar work at the foundation as well. Now, the fourth use case here is the patient-facing solutions. So what AI solutions exist currently that can interact directly with patients, and they can provide, for example, non-clinical therapies or information and advice. And I presume that many of you are familiar with Ping An Doctor in China, the Ping An Good Doctor in China, where here we're really seeing an innovative, and in some ways, many ways, the holy grail here, where patients can have access to a platform, and when they're sick, and they can have their medical records paired with an initial triage of some of their symptoms before then being transferred to a doctor for confirmed diagnosis. And then with that, depending on the diagnosis, can then be referred to a clinical site for treatment, or if not, can reach a prescription and even get their medicine sent to their home. So for us, this one-stop shop of medical services is really, really compelling. And with that, it's also interesting how, for example, patients can also use on-site machine-operated devices in different settings and directly interact with their AI doctor And so here again, I think really relieving pressure off the health system, providing better, closer to home care for patients. And in a country like China, the scale has already been enormous, where they're seeing 729,000 daily consultations, and we can only imagine how that can be replicated in other settings. From what I understand, Singapore as well is currently looking at using this model in their country, in their city. And so this is one example. Another example that is not on a slide right here, but we're excited about the work that Babil Rwanda has been doing in Kigali and Rwanda, where in a setting in a country like Rwanda, where you have an incredible shortage between healthcare workers and the patient population, they've introduced essentially a telemedicine service where online consultations can be made with community health workers, where patients have direct access and then can be referred to a specialist. And what's exciting here is that they've developed a 10-year partnership with the Ministry of Health, where all consultations are being reimbursed by the National Mutuelle Insurance. And what they're doing is that with their parent company from the UK, Babylon, they're introducing an AI solution at the onset. So when patients can come in, they can already get an early diagnosis and triage with a chatbot that can then help improve and accelerate the diagnosis of these patients when they address the health system through this solution. And from what we understand, already 2.5 million people are within this service. So really, I think compelling solutions coming within this use case here. Now finally, optimizing of health operations. So in the report, there are several examples there whereby AI solutions are helping health centers, hospitals to improve schedules of healthcare workers, for example. We're also looking at supply chain management for medications, and I think there's many examples coming up here, but one that I also wanted to highlight, which we're excited about, is one from the Danish company Corti, where in emergency calls, patients who may be having a cardiac arrest, there's an AI solution integrated into these calls that basically through natural language processing can identify through the breathing and the language used by the people calling as to whether they are going into cardiac arrest, and through that can then help dispatch emergency services quicker, but also can help inform the dispatch team as to already a kind of preliminary diagnosis to help them when they arrive on site. And so these are some of these examples where discrete interventions, but can really have a high impact on patients and on lives. So with that, I hope this is kind of giving you a little bit granularity of some of the examples that we've highlighted in the report, and how perhaps the structure can show and distill a bit where we're seeing tangible examples of AI being leveraged already to this day in healthcare systems, and already having a really great impact on people's lives. So with this, the last part of this report that we've introduced, and will be a continued piece of work for us, the Novartis Foundation, going into the year, is a maturity roadmap that we've presented. So a framework, again, kind of structuring where we see the important pillars of work for governments and countries to really be thinking about. Now, these are outlined here, and I'll just run through a couple of them just to again, provide what we mean by here, because you can see some overlay with some of the findings from the previous reports. But the first one is around people and workforce, right? So we think there's an important gap to fill when it comes to bringing curriculum on data science and AI within the education structure and universities. So again, the question is, if physicians, doctors will receive some form of physics education to understand how an MRI machine would work, for example. Similarly here, it's really critical that the healthcare workforce understands how these AI solutions that they're interacting with work, what they can deliver, and that will just help, again, create this synergy between person and machine and AI to really to deliver the best quality care for patients. And so with that, there's an education component. There's, of course, a training around how the solutions can be integrated. There's a realistic change management component here as well, where there's still much reticence as to how these solutions can be used and fear around it. So I think, again, for countries to think about how they're integrating their systems and making sure that people understand what they're working with. Now, the second one is data and technology. Again, these are maybe seem obvious, but there's really big questions to ensure that we have the quality data that can then train the algorithm of care. How are we making sure that the data how is data collected? how are we getting these large volumes of data? How is it being stored and processed, and what is the infrastructure that is required to make sure that this can be leveraged? And also, how are we thinking about the questions again of interoperability and explainability of these AI solutions? And once more, this is the question of how can we explain the outcomes that are being generated by some of these AI solutions, and that's part of this sometimes the distrust that's coming out in these discussions, and really an important piece for governments to understand and provide guiding principles of what kind of our bare minimums when integrating some of these solutions. When it comes to governance and regulatory, again, this is the same call to action, but an important one where governments need to take the lead, need to provide the strategies of how these solutions can be integrated into the health systems. What are the budgets that are allocated, and are they sufficient? But also, what's the validation process for AI solutions that are being, again, brought into the fore? And are we making sure that privacy and patients' rights are maintained? And what are the data governance questions that need to be addressed as well within each setting? The fourth one here, design and processes. Again, we want to really underline the importance that AI solutions need to be people-centered. It shouldn't be technology-driven. It should be what are the people needs, and again, how can these be integrated within the existing clinical workflows, right? Otherwise, it creates layer of complications, and this can sometimes just be more undermining what we're trying to achieve when introducing some of these AI solutions to improve efficiency and improve the quality of care. And last two here, partnership and stakeholders. We see this importance of governments taking a leadership, identifying all the partners and the diversity of partners that need to be involved in this, and really creating needs-driven partnerships where we can ensure that people are working in structured ways, that we don't have just an array of pilots, AI pilot solutions emerging in different settings. And finally, here on business models, it goes back to the point of financing and creating business models that are sustainable. So how are we thinking about different versions of funding, innovative ways of blended funding to make sure these solutions have staying power, but also how are we making sure that solutions have components of monetization so that they can actually be continued, and what are the public-private partnerships that really need to be brought to the fore to make sure they can work. So I hope this can give you some detail. Of course, there's a lot more to be read in the report, and what we're excited about here is that we provided lengthy examples of what we mean per these different pillars as to what countries can really think about to define as to where they are on this journey of exploring the question of AI in health and around these pillars, and to where they start really activating and working on these to becoming then an integrated ecosystem. But the main point again here is it's really important that nations think about these 6 pillars holistically. It's not about just targeting one or the other, but all of these together really make sure that they can provide an enabling environment for AI solutions to be fully integrated and to thrive in existing healthcare systems. So with that, we really have no time to lose. I think the message is coming clear from the Broadband Commission, and that AI can empower patients to manage their own health, that health providers can deliver better health care, health managers can optimize health systems, and governments can improve their population health if they really see the opportunities and leverage AI in a way that can really benefit them in their day-to-day work or in the management of their disease when it comes to patients. And the time to act is now. So we hope that all of you who are as well joining today can be part of this journey we're all still learning of how can we, accelerate the use of AI solutions and make sure that it's done in the right way. But we really see this as a global and national priority to make sure they can be fully integrated and are an integral part of any health system. So with that, on behalf again of the members of the Broadband Commission Working Group and our co-chair, as well as all the external experts and this network here, AeHIN of practitioners, we just want to thank everyone for all the work that's been put into this. And we hope this can be a continued conversation going into 2021. One of the elements I want to again highlight is that the pillars there, the maturity framework for us, is we're transforming into a tool that we can then share with global health actors, institutions, and nations to kind of help assess, especially for countries, where are they on this, what kind of level of maturity are they around those pillars, and where do they really need to focus their energy and investments in the years to come. And so this is a tool that will be available in the next year, and we hope to have multiple stakeholder dialogues around this, and hopefully we'll have some more of you and encourage you to reach out to us. So I hope this is a helpful overview, and I thank you again for your time, and I look forward to the following discussion today.
Yes, thank you, Sir Jason. So to all our participants, we're now open for questions. So for the first question, Sir Jason, what spurred the Broadband Commission to select AI as a topic of this report?
As you're saying, there are definitely, of course, many technologies that are out there, and AI is one of them, and more to come. But I think that it became clear that there was a call to action here for broadband commissioners and an opportunity to really kind of deep dive on this particular topic, given some of the broader discussions that were taking place around it, and some initial reports that were already being kind of worked on, but where we felt there was a need to dive deeper and actually show what is happening with existing use cases and help inform a bit and structure what is possible. And so I think this was as well had already started kind of emerging as a topic in the previous report in the 2018, the kind of promise for digital health. But given the existing need and interest around AI, that's the reason the Broadband Commission chose to work on it.
Thank you, sir. Our next question is, AI is a highly technical topic. What can governments do to stimulate AI adoption?
I think from all of us, it's a learning in itself, right? And so for us, this is why we've introduced this framework, right? This maturity roadmap, which is that depending on the country, and this applies for all countries and level of development, but we're hopeful that this can kind of categorize where they may perceive gaps in their system in terms of either just be understanding what's available, what are the technical capabilities they have already within their systems in place, but also I think there is a bit of a learning journey that needs to take place here, and it goes back to thinking about what are the partners that can accompany governments to do so, right? There's whether it be assessing the right technologies being introduced, and also making sense of all the various type of solutions being brought into countries. I think it's key, again, this notion of government leadership and understanding what's taking place. So do they have the right partners to assess that and also validate tools that are being brought in? I think as well, there's this question of kind of, of all the data being generated, what are the kind of data collectives and, let's say, ecosystems that they can help bring in and develop to foster the kind of collaboration that is needed to advance in this area.
And the next question is, AI is a complex academic topic. How can it be best explained to citizens?
I think there's definitely an element of kind of, that AI has an overhanging description of multiple technologies, right? And I think there's a socialization of the actual technologies themselves. But I think this brings us probably to the question of explainability, right? And often the trust as to whether you're a healthcare provider or a patient, can you actually explain how this AI reached a certain conclusion, whether it be in terms of predicting a certain risk score on a patient's health, or whether it be in terms of predicting a certain therapy for a patient, or in terms of analyzing certain images and creating a certain diagnosis, right? And so there's really, I think, an important piece here for governments to think about what are the right principles and the right validation, and making sure that those who are providing the AI solutions can explain how they work. And so I think that's part of that socialization of AI solutions to the more broader public. But of course, I invite anyone else who has expertise on this to also provide their own response, because it is a complex.
The next question is, what's the difference between Ping An and Babylon?
So the short-term difference is just that they're different companies operating currently in different geographies. But I would say that the Ping An is in many ways let's say it's a much larger program at scale, given just the population and healthcare system in China. It's quite an impressive one. And I think in many ways, when we see what they've been able to achieve in creating this kind of one-stop shop from consultation to referral to prescription, and actually really enabling patients to have all of these at their disposal is really quite effective. When it comes to Babylon, Rwanda, the reason why I brought up that particular example is that Rwanda still is a setting that's probably leading the pack in terms of the sub-Saharan Africa continent in terms of being a hub for innovation, and also has a really strong government structure to kind of bring in these type of solutions and think about how to improve its healthcare system, but it's still lacking in many ways in terms of resources, right? And so to be able to think about such a solution like the way they've introduced there, where already 2.5 million patients have access to a consultation service that's being reimbursed, is a big step forward. What's really exciting is that Babel has these capacities from its parent company in the UK, where in the UK they've developed an algorithm that actually passed the medical certification test at a really high level, and so was able to kind of, with that experience already in the UK, generate a lot of interest. But as they're applying, and they're not translating that one directly into Rwanda, but they're using that experience as well to develop. In this case, I'd have to get more precisions, but I think it's more of a chatbot triage solution that patients call in and can get already some preliminary diagnosis before being sent to a healthcare worker. So again, it's the difference between the two is, of course, different companies, different settings, but there are some similarities in the way that they empower patients to have easier access to care, especially in settings where there's a big gap between healthcare providers and the number of populations, the number of doctors per population.
I have two questions here. The first one, is there an opportunity for countries with different languages to share AI algorithms? And second, how can countries actively participate, or should they just be passive participants who just wait for advanced countries to develop the algorithms?
Yeah, those are great questions. Now, I think in terms of language, I think the underlying code for AI solutions is transferable, right? I think the question of how can, should certain countries remain passive, I think that would be definitely a no on this one. They really have to think and prepare themselves to have this enabling environment so that AI solutions not only work for the populations that they serve, right? Because certain AI solutions might have been trained on patient data that might not be representative of the populations in another country. So that's one. I think also it's really important that countries really think carefully about the questions around privacy and patient rights, and how is their data used and shared across platforms. So again, that does require work and sophistication to understand these elements, and that being passive is not the right solution. Now there is, of course, I think there's learnings that need to take place between different settings, right? And this can go from high income to low income settings depending on where the solutions are emerging. But I don't have the details exactly in my hand right now, but there's one example that we've seen recently take place where an AI solution in China was developed to do a better diagnosis of lungs to see whether a patient had COVID or not. And they're able they're able to share this example with hospitals in Brazil and Sao Paulo, where they're able to replicate that model, and that really helped to accelerate the diagnosis of certain severe cases of COVID patients. So again, this rate of innovation and sharing across countries is happening live, and I think it's really important again that we see what's out there, what is working, and that can help inform how countries can think about their needs and what they would like to develop in their settings, and whether they choose to work with partners that may come from another country, bring them in and localize a solution is one way. But also, I mean, I think there's many opportunities of all the kind of emerging entrepreneurs in local settings in any kind of, whether it be low and middle income countries, where I think we're going to see a lot of exciting things come ahead as well.
Thank you, Sir Jason. We also have Mr. Mark Landry from WHO here on the call. Sir Mark, would you like to ask this question directly?
Yeah, great. Thanks, Jason. Brilliant presentation. I appreciate it. And yeah, basically, if you're seeing what I wrote in the chat, but we have a lot of countries in low and middle income settings who are really enamored with AI and machine learning, and they want to know, what can I do? How do I apply? And they're spending a lot of resources, monetary and time and energy, but they really are struggling with an appropriate use case to make it, actually valuable in their context. So what are your tips? How do you advise a country that has very basic digital and data issues with embracing AI in parallel with so many competing demands, what would you say to these very low resource settings in environments? What to do next with AI, given the rapid developments and ongoing opportunities that it brings?
Yeah, that's a really good question, and it is a challenging one, right? I think, especially with the current pandemic and pressures on healthcare systems, how can governments and ministries of health really think through where they prioritize their resources? When it comes to adoption of AI, it's the question of lack of resources, and this question could also sometimes, into like, you put it on a back pedal and focus on other elements, but at the same time, I think we all recognize that you have to be thinking about this in terms of the kind of these pillars of structure, and I think identifying where are your gaps so you can make the most of these emerging solutions. But the underlying question where I think you're thinking about when it comes to what's the existing data in healthcare systems around certain populations, certain disease areas, it can be very poor, and that's obviously a key starting point to think through these issues. And so one area that we are looking at right now, the foundation, for example, is kind of thinking through, if you take the context of sub-Saharan Africa, right? I think there's a lot of opportunities to really kind of help support and platforms like DHIS2 to see how those data are being improved and how the data collection structures are being improved, so that then they can create that right foundation to enable AI to really reach its potential. I think another element that countries can be thinking about is how are they looking at creating data collaboratives around certain disease areas, and this is where I think they have to take the leadership in thinking about what are key priority needs and where this could have a benefit. So I think it's part of the exercise to really think through. But I do appreciate the challenge, and again, I don't know if there's any current representatives that are working in government that are facing this challenge, but it would be interesting to hear from them as well. But I hope that helped answer some of your question.
Sorry, quick follow-up. What are low-hanging fruit for LMIC countries in AI?
Well, I think that what I'm seeing a lot right now is conversations around this notion around education, right? And you often kind of take it for granted, but I think there's elements of how are we integrating the right type of education in universities for the future healthcare workforce, right? And really nurturing the talent as well of people, data scientists in country settings, to start focusing on certain healthcare sector needs. I think that seems to be, obviously, it's not exactly a short-term one, but I think one that can be done. There's a lot of information out there, and I think a lot of partners keen to work in that area. I think that as well, that maybe the one element here as well is what I'm particularly excited about. I'm curious, Mark, if you're seeing as well in WHO with the magic box example from UNICEF, right? There's all these data sets coming from different sectors, beyond the healthcare sector, right? That could be leveraged and have better inform and start creating a better understanding of populations at risk for certain diseases, or improving epidemics, measure epidemics. I see that as well there as public-private partnerships that we're kind of pooling that data to improve, and use the predictive analytics that can be used as a low-hanging fruit.
Right. Thank you, Sir Jason and Sir Mark. Next, I would like to call on Sir Jai Ganesh from the AeHIN leadership.
Thanks, Shah. Thanks, Jason, for the excellent presentation of the work group reports. And it has always been a pleasure to work with the Broadband Commission. We have had a long-standing relationship with the Broadband Commission. And then I was just having two of these thoughts. Any machine learning algorithm involves selecting and arriving at the right set of training data. It's as good as the output is as good as selecting the right choice of data, and to what level we can make this algorithm predicting the right way. So especially in a pandemic like this, where we have having this list of symptoms is growing, getting added every day. So it's going to be a challenge to actually arrive at what could be the right sample size or the training data. And then the second observation that I have is, do you have any examples of course, we hear a lot about countries like Estonia and other examples where they are far ahead, but then are there any examples from the LMICs where the government has already put in place regulations for AI for the use in healthcare? That is another. And then one of the points which Mark made, is actually related to the use case development itself. My institution is involved in a couple of AI-related projects. For example, identifying cardiac fibrosis from our database of chest X-ray images. Like we have a whole lot of images for last couple of decades in our stored in our packs. So we are working on that. In that, like what we found is forming the right use case is most important. And we found that the Data Science Institute, where in ACR, American College of Radiology, has a very good framework for that. So these are the thoughts that I thought I will share with this. Thank you.
All right, thank you, Sir Jai. I think we have a question from Dr. Fazila.
Hi, Jason. Thank you for the great presentation. I have a question. This was done much earlier prior to the pandemic. What would be different if this was done now? This report. Will there be a different use cases, or will the pandemic itself bring a new perspective for this entire paper? Thank you.
I think that it's an interesting question, right, about whether the report had been different. I think we framed it more that it seemed like the report came at the right time in many ways, because given the pace of innovation that's taken place as a result of the pandemic, it would say it just kind of emphasized again the need to think through the core recommendations of this report. But for us, what we are doing, and as part of this work going forward in terms of this maturity framework, is that we do want to start working with countries and with other global health institutions to just help understand a bit where countries are on this maturity framework. How are they looking at the integration of AI solutions, and where are the key barriers and challenges that they're facing? And so kind of continuing this review of case studies as well as part of that work. And so I think to answer the previous question, like what are other countries where we're seeing, let's say, similar work as Estonia, I wouldn't be able to kind of pinpoint straight away at a country level, but we hope that through this exercise we can really look at and start defining, seeing where there's really some great progress, especially as a result of the pandemic. But we are starting to see some cities and other areas that, of course, are working around this. And I think for us as well at the foundation, we're trying to kind of advance this work through cardiovascular population health strategies and building data collaboratives to essentially create better quality data that can train AI solutions around better predicting of cardiovascular risk for patients. So these are some of the work that we're looking at. And I think just one thing on the Estonia question, I think it's what's interesting is that's obviously sometimes the main kind of example that's come out, but even that one hasn't figured it out perfectly, right? Every country is still learning their lessons. I was just learning, for example, the other day that despite the way they have the data transparency there, you still have issues, for example, when a parent can start seeing data on adolescents on their own kids, and how that impacts their own right as to regards to how their patient data is shared when it comes to, for example, family planning and other issues like that. So I think every country is still on this journey trying to figure out how to create the right principles and right enabling environment to really make the most of AI solutions.
Thank you, Sir Jason. Next, I would like to call on Sir Derek Ritz.
Thanks, Cha. And Jason, that was a really terrific presentation. Thank you for that. I think that I probably am echoing a little bit what Mark had brought up, that there is a lot of attention being focused on AI right now. It is a topic that garners a lot of interest because of how much promise it holds. But I guess I would like to suggest that it is a double-edged sword as well. And the reason I say that is because we have to, as health informatics professionals, take the same oath to heart as our clinicians swear, and that is to do no harm. And there are some very, I think, useful progressive steps being taken regarding the regulation of artificial intelligence and regarding approaches that we will be able to leverage to know that all of the ways that we use this powerful technology are patient-safe ways. The whole notion of something that is 90% or 95% accurate is very helpful and very exciting. But if that means that it's 5 or 10% wrong, then that's 1 in 20 or 1 in 10 situations where it is giving advice that potentially is adverse to the patient. So there are, I think, some important progressive steps being taken regarding regulation. I'm curious to know, Jason, what your sense is of the pace of progress, and maybe even interestingly, to what extent you think that we should, on the deployment side, be waiting if there are situations where countries don't yet have regulations in place. To what extent do we look in favor of the innovation as opposed to in favor of the safety side? Thank you very much.
Yeah, that's a really good question, and I think maybe just to clarify it as well, I think that from the report point of view, the goal is not to say, full gung-ho blind, kind of blinded, saying this is the perfect solution. But I think it's really to say that, deconstruct a bit the hype question and be able to say, that governments really need to be thinking carefully about this. And if they don't, they might miss this next kind of acceleration in terms of innovation and the opportunities that AI might bring, right? But with that, there are some serious caveats, as you and Mark said, in terms of making sure that the right regulations are in place. And we wouldn't want to, in any case, in any way, kind of seem as saying you put away patient safety versus the need to accelerate on a given technology, right? So I think it's really critical that that both the privacy questions, the ethics around certain AI solutions of use are really very clear, and I think that's a key role for governments to make sure that those principles are put in place. That they're thinking. There are examples, as you know, right, from at the international level. Some of these are really being put out. And I think at the national level, they need to be very clear about this. But also, I think the challenge here, for your own work, I think is, and hopefully this report can help in that capacity, is to help inform again what should governments be thinking about before just blindly accepting certain technologies, right? And this again is what are those core components, where can they start, is a critical part of this journey. And so I just hope that clarifies that we're not just saying gung-ho blinded, but I think we just need to really thinking through, as all of us, in terms of healthcare providers or global health actors, as to how, as we're engaging and helping governments, supporting them in terms of their strategy, helping validate the right solutions and making sure that there is no harm done by these new solutions, and also just helping connect the right partners that are needed in this new space.
Thank you, Sir Jason and Sir Derek. What would you advise a network like AeHIN that we can do to properly adapt AI in our respective countries, but also work on together in our region?
Well, when it comes to the Broadband Commission's work, this is again a high-level commission group that as an advocacy group tries to provide recommendations for nations to support them in their development agenda. So in this case, we would definitely encourage that the learnings and findings here can be shared as broadly as possible. But also we, as a network, I think you have an enormous impact and reach, and it could be really interesting to have to kind of start these dialogues with ministries of health and helping them think through and review of their AI strategies of kind of what can be done. I think this is something that we, at least the Novartis Foundation, be really keen and interested to work with you all next year, especially as we develop this assessment tool. And I think this would come along as well. We're looking at other global health institutions who'd be interested in working on this, either through their global headquarters or regional outposts, to conduct such activities. So I think this is something that I hope that can be done, and we'd love to work with all of you on this.
Thank you, Sir Jason. There's a new question here from Dr. Chamika from Sri Lanka. So what is your opinion on having open access machine learning data sets in terms of healthcare?
So I think, again, this is one of the critical steps, right? We need to make sure that the scale of data is of quality and can be accessible to anyone who would be able to want to train AI solutions on this. And that's why I think these data collaboratives are really compelling. And again, an example of the work that we've done, and I meant to highlight before, but the Apollo group in India and Microsoft have leveraged the data from their network, and we are now looking at programs that we've worked on in settings in Latin America and Sub-Saharan Africa to create a data collaborative on cardiovascular health, and making sure that this data, not only that the core questions of privacy, making sure this data is is used properly, but also making it available to as many partners who'd be interested in working on it to see how we can develop and train certain algorithms that could help predict and create risk scores for patients at risk for cardiovascular disease. So we're very much, at least from a foundation's point of view, promoting this crucial step of making sure that data is openly accessible.
Thank you, Sir Jason. We also have a question from Dr. Bunchai. Are there any AI sample on health administration part, like claim predictions and claim fraud?
Maybe some participants on the call may have exact examples here. I don't have one to pinpoint today, but there's definitely some solutions out there. I could do some research and share with you afterwards.
Thank you, Sir Jason. Maybe before we wrap up this call, we can hear some words from Dr. Alvin and Dr. Bunchai.
Thank you, Jason. We learned a lot from your talk. You mentioned about an evaluation tool or a framework that you plan to come up with. I think once you're ready, let us know so we can leverage the network in helping out with the evaluation. I think this is a good time to increase the awareness and also promote, the language of artificial intelligence in a way that it will make it easy for governments to understand what it's all about and what are their important roles in making sure that AI is used properly for their respective countries. So let us know when the evaluation tool comes out, and let's hold another session on that. Dr. Bunchai?
Hello. Thank you, Jason, and all the participants. I think we have a full house today, and it's very interesting topic. And thank you for the broadband commission that had worked with our network. I would like to add a little bit that our network, AeHIN, right now are working with the MIT Critical Data Group with Dr. Leo Silly from the MIT on AI, curriculum that we encourage the AeHIN from members to take the course on the learning about the data analytics and AI. The mechanism of that. I think with those education or the strengthening knowledge in our network, I think we can catch up with the rapid change of what is going on, and we can work with our government to kind of advise or something like that. Another one is that it seems like you work with the Novartis Foundation. That is one of the foundation that contribute a lot on the digital health. Just to inform you that a lot of our network capacity building is all support by many are support by developing partner, like for this kind of the education for AI curriculum with MIT. We also have some support from the McGovern Foundation. So I think if you have some kind of the if the Novartis Foundation has some kind of the opportunity that we can leverage the or strengthening workforce in our network, is we can work with the foundation. And I would like to thank you, Dr. Jason, and also the participant that come today. And we hope that we will have more conversation or the working together on this. Thank you.
Thank you very much. It was a pleasure to be here. Thank you again for having us.